The anatomy of cranial nerve 7 arises from the pons and medulla, starts as a large motor branch and small sensory root, and travels through the temporal bone, enters the facial canal, and fuses to form the facial nerve. Intracranial, it exits just posterior to the temporal bone. Extracranial, it turns superiorly and runs just anterior to the outer ear. Then it terminates by splitting into 5 branches that are responsible for innervating muscles of facial expressions. As found on page 392 of our neuroscience book, the facial nerve has function in many areas of the nervous system. Somatosensory is efferents for sensation to outer ear. Motor function is muscles for facial expression. Visceral is taste from tongue. Parasympathetic is input to glands. And reflex function is corneal reflex, which is involuntary blinking.
Clinical presentations for facial nerve pathology include disorders or conditions that result in facial paralysis. Ramsay-Hunt syndrome, which is caused by the shingles infection, results in acute facial paralysis, ear pain, and blisters on the external ear. If the cause of a lesion is unknown, it is classified as Bell's palsy, which is general paralysis caused most likely by inflammation of the nerve. If the facial nerve itself is affected, the symptoms will be ipsilateral to the lesion. But if lesions are found in the motor tract, then the symptoms will be contralateral and affect only the lower half of the face.
Okay, so today we're going to test for your cranial nerve number 7, which is your facial nerve. We're going to do 3 different tests where I'm going to work with you, and then I'm going to ask you 2 questions at the end, okay?
Yep.
So the 3 tests we're going to do is I'm going to first have you go ahead and raise your eyebrows really high up to the sky and hold them there for me. Don't let me move them. Good job. Next one is I'm going to have you squeeze your eyes tight, and I'm going to try and open them, okay? Good job. Last one is I want you to do chipmunk cheeks, and I want you to hold them really tight for me, okay?
Yep.
Good job. All right. Have you had any changes in your taste?
Nope.
Any changes in hearing?
No.